Hello everyone, my name is Haider and we are back with the anatomical terminologies related to positions and different things about it. So let's continue. Now we will talk about some basic terms which are used especially to the foot, limited to the foot. We talk about inversion and eversion. In inversion, the turns sole of the foot inward or medially, that if you stand on the lateral border of the foot is called inversion. This is a diagram, a simple diagram about inversion. And if you see eversion, it turns the sole of the foot outward laterally, that if you stand on medial border of the foot. This is known as eversion. So these are the terms related to the foot. Now we talk about protraction and retraction. Protraction is actually the term which is mostly applied to the shoulder girdle and lower jaw. Protraction is actually a forward movement. Retraction is a backward movement. For example, if you see here, in the protraction, the lower jaw moves forward. And in the retraction, when you move this jaw from forward to backward, this movement is known as retraction. And same with the shoulder girdle. If you move your shoulder anteriorly and ahead, it is known as protraction, and you move them to the back or the same position, it is known as retraction. Now we see about elevation and depression. Elevation is raising a body part, depression is lowering a body part. It also applies to the jaw or to the muscles also, or to the body organs and limbs also, that lower jaw is elevated when the mouth is closed. When you close the mouth, it means your lower jaw is elevated. And if you open your mouth, the lower jaw is depressed. You depress the lower jaw to open your mouth. Now if you see about opposition and reposition, concept of the thumb especially. Opposition is that during opposition, the thumb pad is brought to touch and oppose a finger pad of an extended finger. This is opposition. And reposition is to bring it back to the normal position, or reverse the movement of thumb that returns it to the anatomical position. This is about the opposition and reposition of the thumb. Now we talk about terms of laterality. There are some terms. The first term is bilateral. Bilateral is the actually structures, organs or condition which occur on both sides, left and right of the body, are referred as bilateral. For example, ears are bilateral organs. Kidneys are bilateral organs. In medical prescriptions, we write bilateral as B/L. This is bilateral. For example, if there is pain, we will say that bilateral pain. So this is it. And if we talk about unilateral, any structure, organ occurring on only one side of the body, or even a condition occurring on only one side of the body, is referred as unilateral. For example, spleen is unilateral. Vermiform appendix is also unilateral. In medical prescription, the vermiform appendix pain is known as RAF pain, right iliac fossa pain. So we can say that appendix is present only on the one side of the body, which is known as unilateral. If we talk about ipsilateral, ipsilateral is structure occurring on same side of the body as another structure. For example, right hand is ipsilateral to the right foot, but the structure are different. So ipsilateral is the sidedness of the structures. Another term which is known as contralateral. Contralateral is actually structure occurring on the opposite side of the body with reference to another structure. For example, right foot is contralateral to left foot. These are the opposite directions. So right foot is here, left foot is here. So right and left foot are contralateral to each other. That was all about the terms. And one more interesting thing, that if you number the digits of the hand, then it starts from lateral to medial. From laterally, your thumb is the first digit and your little finger is the fifth digit. But if you saw about the foot, it is from medial to lateral. That from medially, big toe is the first digit and the little finger or the little digit in the foot is the fifth digit. It was all about the anatomical nomenclature.